So good morning, this is Josh from Just Life Balance, and this is just I say a quick recording, but it might be about 20 minutes just to give you an understanding of the time of a presentation that I did on Saturday at Medicides, which was the importance of the emotions. And to make life a little bit more difficult as well, I tried to add in a little bit of a crash course of acupuncture into it as well, so that you can kind of understand a little bit more about what I do and what I think about when looking at treatment. So to begin with, acupuncture is really incredible. It can help with so many different things. That's whether it is an acute injury, so something like acute lower back pain or chronic illnesses, where things get a little bit more complex as well, and there might be several things going on. And I think, here's just a small list of things that I have treated in clinic. It's not exhaustive, but things from kind of mental health, which is really, in a sense, what this talk is on, but also things like fatigue, burnout, autoimmune, digestive, headaches, migraines, particularly this year, seem to have been quite a lot. Women's health, fertility, insomnia, things like that. And I think one of the ways that acupuncture is really helpful in all of these is it's because it takes a different approach to health and has a slightly different lens. So I guess, for example, how I found acupuncture was through what the doctors called IBS, and I'm not 100% sure it was, but they were always, the problem is in the stomach, so we're going to treat your stomach, and actually going to an acupuncturist, he said, oh, the problem's all in your liver. And that just gives you a sense of how we see the body as being a little bit different. And that's where sometimes complex cases, particularly in chronic illnesses, we tend to get really good results because Western medicine doesn't seem to always be able to help. And for us, it's understanding not just the Western condition like I've shown here, but it's about understanding you as a person. So, how are the different symptoms that you are experiencing, and if there's a kind of a common cause underneath all of that. So we just take a slightly different viewpoint. And it's things like understanding you as a person, so your constitution, understanding the the kind of connection we have to the environment. So things like if you can catch a common cold through being out with a kind of a cold draft and it being windy, it's seen as kind of a wind cold invasion for us. So it's understanding those sort of things, but understanding, mentality as well and all of that. And what let's talk about is really doing is understanding how emotions can have a role in illness. So my first lesson in this talk, or that was on this talk, was understanding flow, which for us in Chinese medicine is the concept of qi. Now, qi is seen as kind of like the energy or the motive force in the body. So it's what happens behind all transformation and kind of physiological processes. And really, what acupuncture is looking to do is manipulate the flow of qi in the body to encourage what we call free flow. And part of this is looking at what we call the three treasures. So Jing, which is our kind of our physical form in a very simple sense. Qi, which is the movement and everything that moves and changes in our body. And then Shen, which is seen as the spirit. And what we're really looking at when we are inserting a needle or manipulating a needle is we're really looking at influencing someone's qi. And now you can see that when when we are looking at qi, it can impact both the physical form, so the manifestations, which is where we see really good illnesses, but it can also affect the emotions and kind of what we call the shen. And the shen's often seen as or seen through the radiance in someone's eyes. So sometimes when we've got like a really complex chronic case or chronic illness, you kind of see a dullness in the eyes, and then as you start to treat, you start to see this kind of like the spark and the twinkle in the eye. So that's one of the ways that we know that we're going in the right direction. And these three are always working together in many respects. So kind of working on one is working on the other two. And there's kind of this triad of things that we're always looking at in acupuncture. But fundamentally, what we're doing is we're affecting the flow of qi. And one of my favorite phrases in Chinese medicine is this, and it essentially translates as when there is no free flow, there is pain. So when qi stagnates or stops moving, that's when we tend to see pain. And when there's a free flow of chi or energy around the body, we tend to be in good health. Which sounds a little bit more Eastern medicine, but one of the things that makes it a little bit easier is chi and blood are seen as interconnected. They're kind of a yin yang pair. So, really, when we're talking about chi, we can use it interchangeably in many respects with blood. So, we're just encouraging the free flow of blood throughout the body. And how we do that is through manipulating points on the channel. So, we have over 12 channels within the body. And you can see here, this is just an image with a series of the points that we can use. So we manage the free flow of chi to make things smoothly flow, and we do that through needling points. This is just an example. This is just a small sample. We tend to use a lot of points on the kind of the hands and the legs and the extremities rather than the chest, but it's a nice diagram, I thought. And there's over 365 points. There's a lot to choose from. So going a step further, well, so to summarize, we're looking at the free flow of chi, we're encouraging the free flow of chi. And there's various ways that we can understand this. So one of them is what we call the five phases. So it's understanding how the different elements in acupuncture are working together. So you can see here, the metal is to do with the lungs, and it's also to do with other resonances like the autumn or acceptance, grief, things like that. And what we say is that the metal feeds the water. So, for example, the lung feeds the kidneys, but then there's also the fire here, which is more to do with this kind of the summer, the heart, and so on. And that then controls the lungs. So there's this interconnection between all of the phases and organs that are constantly working together to understand how the body is functioning as a whole. So you get this kind of channel perspective and how the flow of energy is moving throughout the body. This is a picture of an ancient description and kind of image of the lungs, which is seen as the kind of the canopy, partly because it's the highest organ anatomically in the body. So it's seen as like this canopy that brings things in and then descends things and kind of diffuses throughout the body. So you can see it from an organs perspective. And sometimes if someone's lung isn't functioning correctly, it's kind of an easy one because you get things like kind of shortness of breath or coughing, panting, things like that. And so we get a channel perspective, which is the 12 channels and the flow of energy. You can also get an organ perspective. And then how we manage these is through the actual channels on the body, which you can see here, the lung has got 11 points, starting from sort of in the pecs and goes down to the side of the thumb. So we can use each of these points have slightly different features or influences on the body. But if someone, for example, has got a lung problem, we can use one of these points in our treatments to work on the flow of chi in the body and the lung meridian. So hopefully that's all making sense so far. We're kind of coming on to the importance of the emotions. And one of the great quotes from a scholar of Chinese medicine is all diseases are rooted in the spirit, which is by Jeffrey Wen, which I think is true. And, in acupuncture, they classified illness into three categories. So the first one is internal causes of disease, which is the emotions. Then you get external, which is the more climatic influences, like I said about the cold and how we are in terms of the relation to the environment around us. And other things like, damp houses and things like that can cause dampness in the body. So we're always working with the body and the environment. And then there's also the third category of illness, which is more miscellaneous. So things like COVID or poisonings or things like that, where it's nothing necessarily to do with our body. So those are the three categories of illness in Chinese medicine, and really this is digging a little bit deeper into the first one, the emotions. And this is a really cool diagram, and then kind of it's from a study that was done in Western medicine that kind of really goes to show that Chinese medicine was onto something when they started looking at these sort of things, 2,000 to 5,000 years ago, roughly. And you can see that the emotions that we feel has an influence on the temperature inside our bodies and the temperature in different areas of our bodies as well. So, for example, in anger, you can see that everything rises upwards and it goes to the head, which for us in Chinese medicine, there's a one particular condition for us is called liver yang rising, which is often seen, you get a lot of anger and things like that. So it kind of really does show quite well the impact that the emotions has on the body, and we see that in TCM terms as well. And you can see things like depression gives a lot of coldness throughout the whole body, which for us, coldness is often a cause of illness. It's either things get hot or cold, it's kind of a yin and yang pairing. And when everything is cold, it then contracts and there's no movement. So again, that is a kind of a cause of illness. So kind of the contraction of the cold and kind of depressive states in a sense. Whereas all the anger all rises to the top, so the bottom isn't rooted. So there's a lot of amazing imagery here that shows how what we feel impacts our body. You can get a sense of how our mind impacts our body. My favorite one, and it was pointed out in the talk on the weekend, is the Spider-Man here, the shame. But it's really interesting. I think often the ancient people in China really had a deep understanding of the body, and a lot of Western research at the moment seems to be kind of echoing what they kind of found or thought about all those years ago when we didn't have the technology to do kind of temperature checks throughout the body. And going back to kind of the Chinese medicine aspect of it, so we've spoken about the five phases, and you can see here this is kind of another example where the different emotions are associated with each of the five phases. So too much joy is to do with the fire, worry is to do with the earth, so the spleen and the stomach, which it's said that when someone worries, it's going over the same sort of thoughts again and again, and they kind of can't get out of that negative or that loop. Really, it doesn't have to be negative, but they kind of go over the same thing again and again. And it's said to knock the chi, so kind of things can't move. Um, and then sadness is to do with the lungs and grief and things like that. Fear is to do with the kidneys, which in our perspectives makes a lot of sense. There's the whole phrase of, you shit yourself when you've got a big presentation or things like that. And the kidneys in Chinese medicine is said to be the kind of the master of the lower orifices. So there's a lot of sense there of like when we get fearful, when we get scared, we end up going to the loo more. So slightly more comical, but again, Chinese medicine is onto something there. And then anger is another one of the kind of the emotions, and that's a lot to do with the liver. One of my favorite questions to ask is kind of sometimes when someone's liver pulse feels a little bit what we call wiry, you can tell that, there's a state of frustration or anger, and there's things like kind of aggressive driving is what they call it. It doesn't necessarily have to be you're driving badly, but maybe you're responding badly to other drivers who aren't driving well. So it's one of those interesting questions, which I know a couple of my patients really enjoy. But you can start to see how different elements and organs are relating to different emotions. And then coming back to the three treasures. So before we were kind of looking at chi as what we influence, but I hope that after this little second part of the lesson, you can see that the Shen, so the spirit, our kind of emotions, has an influence on the chi. So we've seen that in the Western medicine terms of, sadness contracts and then you go colder everywhere, or anger, everything rises. So the emotions affect the movement and then that affects the body. So you can see how important the emotions are in terms of managing our health, but also how they can have an influence on the body. So I guess part of Jing is, it's a physical form. So when we feel pain, it's a physical thing. So hopefully that gives you a bit of sense that we're kind of, it works both ways where kind of like an acute injury will affect chi because it can't move, and then that affects the spirit, but it works on the other side. So these things are all so well interconnected. And then going back to this, you can see how when we get stuck in a particular emotion, that then can lead to pain. It's not the case that we want to feel nothing, because nothing is bad. We want to be able to, again, flow freely between the emotions so that there's a kind of a natural rhythm and a natural cycle where we can feel angry as a response to something, but then quickly we go back to neutral and then we go to kind of happiness, or you kind of get that free flow of chi again. You can feel all the different emotions, but you're not stuck in a particular way. It's more about when you get stuck in a particular state that things tend to kind of then stagnate or stop, and then you get pain. But hopefully you can see how fundamental this phrase is of, everything is about just encouraging the free flow and creating movement. So we've kind of spoken about the philosophy of chi and how it's all about movement. We've spoken about what happens when we get stuck in a particular state and how the different emotions are associated with different elements in Chinese medicine. And from a from a treatment perspective and from a kind of a consultation, well, what does that actually mean? And we get in acupuncture, we get four different diagnostic principles really. So we have asking, so listen, well, more listening is more about listening to the patient and understanding their experience of their health. We get touching, smelling, and looking as well, which I'll talk about a little bit later. But this lesson is primarily focused on the questions that we ask and then listening to the patient to understand what they are experiencing. And I really want to look at how the emotions affect us and what that can manifest on the body. So, for example, stress and anger is often a lot to do with kind of the liver, and a lot of it is about, as we saw earlier, that kind of energy rising to the surface and to the top of the body. So you might see that as things like muscle tightness, particularly in the like upper shoulders, upper back, that sort of area. You can get things like PMS, blood clots, high blood pressure, headaches, migraines, that sort of thing. So that's often associated with the liver. And it works two ways of if we suspect someone to be more angry, we can ask questions about, and how is your blood pressure? And if someone talks about headaches and migraines, for example, you can then start to think maybe about stress and anger. So hopefully you can see we're starting to kind of diagnose problems here and understand a little bit more about what's actually going on when someone is talking about their experiences. So anxiety, which is a lot to do with the earth, so the stomach and spleen, you can get things like palpitations, insomnia, muzzy headedness, which is like almost like cotton wool in the brain where you kind of can't think clearly. You can get restlessness, nausea, bloating, things like that. Sadness, which is a lot to do with the kidneys, and the kind of like the grief aspect and the lungs. You get things like oppression of the chest, shortness of breath, panting, coughing, that sort of thing. You can get loss of appetite and insomnia, low energy, and typically a patient can present as kind of like sighing a lot, which sometimes you'll see it actually in the clinic itself, or sometimes you'll ask, oh, and do you feel like you sigh a lot, sort of thing. And again, it's just getting a sense of what's going on in the body. And this is really about asking the questions. And not everyone is going to feel all of these. It's just to give you a sense of when the emotions start to affect us, what sort of things might occur physically. Fear is a little bit more of a strange one, but you can get things like heat in the face, night sweats, dry mouth, and a few other things, but we tend to not be treating that much fear, really. I think sometimes there's a little bit, but I've not necessarily seen it too much, in all honesty. I think some people feel fearful of situations or making decisions, but never the fear that they talk about really in Chinese medicine. It's slightly different, I always find. And then we get joy as well. Joy always sounds like the most exciting one of like, how can you have too much joy? But it kind of scatters the chi, and you need to have a balance of being grounded but also being happy. So you need that kind of like grounding, and too much again brings things a little bit too up to the surface and everything else. And you might experience things like palpitations, a lot of because it's to do with the kind of the heart and the pericardium, so that makes a lot of sense to us. You can get overexcitability, insomnia, restlessness, and talking a lot, but also laughing a lot. So sometimes I find it in clinic where you're talking about something serious or something potentially upsetting, and the patient's kind of inappropriately laughing, is what they call it. So understanding that, you can see maybe there's a problem there, or like there's a kind of a lack of joy, they're not being grounded, they're not in tune with their body, sort of thing. So hopefully these are all giving you a really good idea that how the emotions affect our body, so how the Shen affects our Jing really. And it gives us a sense of if a patient's presenting with a couple of these, we can understand it's the emotions that are causing it. But we can also kind of start to see that, if there's only one or two of these maybe and they start to develop more, it's a sign that the disease is progressing or the illness is progressing. And just having an awareness of this, I hope, goes to show that it's not the end of the world, it's just the beginning, and maybe feeling something too much. And that's a really good time to sort of come to an acupuncturist or just to talk to someone, because I think part of it is we think we have to have a serious illness to come for a treatment. And actually, there's a lot of acupuncture is about providing seasonal treatments or supporting people when they feel like they need it. So I've treated quite a few patients who come just for kind of like dealing with the stresses of everyday life, or to get a bit of a break from, their family situations at home where they can't ever get a second to breathe and that sort of thing. Um, And that was really just asking the questions and understanding the emotions a little bit more. As we are trained to be acupuncturists now, after this brief talk, there's also various other things that go into the kind of the diagnostic process. So there's touching. So all of my patients will know I love the pulse. I'm constantly feeling the pulse to see are things changing, but they also tell incredible stories. Often I'm blown away by what what the pulse reveals. There's so many incredible stories, just too many to recount, but they do give a sense of how the organs are working, so how someone might be feeling, for example. So I had a patient reasonably recently who hadn't talked about having sort of diarrhea in the morning and a little bit of stomach discomfort, but I picked that up in the pulse and gave a bit more of support to that. Often as well, you can tell things like roughly where people are in their periods, which again, the blood is very closely linked to the Shen and the emotions and our kind of our heart. So when you're losing a lot of blood, it's good to add a bit of supportive treatments into that, just so that we can support you, and understanding the pulse, we can kind of get a sense of that and support you appropriately. So I use the pulse quite a lot. We also do things like palpating the channel. So I'm often always asking, does it hurt here, or does that feel like a nice sort of pain? So constantly using the body and how the body is presenting to understand what might be going on. We're also looking at things like the complexion, looking for little blood vessels. That's really a good sign that things are getting stuck when we kind of get the spider veins, and that's a good opportunity to sort of bleed the points, which I quite like. It doesn't hurt, and it's a really effective way of getting the free flow of chi back. We look at things like the tongue, the nails. So, for example, the liver is said to manifest in the nails. So, if someone has a lot of liver or wood issues, we tend to then look at the nails and see, are they brittle? Are they tough? Are they kind of flaking? And so on. And then we also look at smell. So, we tend to see it a bit less, but there's things like, if someone is ill, they might smell like rotten fish, which again gives us a sense of what sort of organs might be imbalanced. So it kind of gives you a sense of all the different things. So, throughout the interview, we ask kind of 10 plus questions, all kind of methodically, and we dive into things more deeply if we need to. But we're also always looking at what the body is showing in terms of what we can actually touch and feel, what the body is showing us in terms of, the Shen and the brightness in the eyes, the complexion, all of those sort of things. And we're also sometimes trying to see, is there any smells? But that one's a little bit more of an interesting one. And then we actually get to the treatment, which is the fun part, of course. But as we know now, hopefully, our health is defined by the free flow of chi and blood in the body. And as acupuncturists, we're manipulating that flow to be able to encourage just a general free flow so that there's no pain. And we've gone through a little bit about how the emotions as one cause of illness can affect the body. And we've also looked at a few of the other diagnostic indicators that help us come to a kind of a diagnosis. So then we get to the actual treatment, and we're using the acupuncture points to manipulate the flow of qi throughout the channels, which then regulates the body and promotes health. And for example, this point is kidney 3, which is really good actually for fear, for grounding people. There's a lot of kind of emotional things that go on through this point, and it's a beautiful point. I really love it, but it just gives you a sense of, if someone's feeling fearful and we're struggling to make a decision, for example, and just needed that little bit more support, we might use that with, for example, some liver points, which is to do with kind of like judgment and getting things done, making a decision, being firm, all that sort of thing. So we can treat a little bit on an emotional level as well as taking everything else into account. But it's also, acupuncture, I think part of it is regulating the body's energy to flow freely, but it's also about giving you the space and time to feel like you've been listened to and kind of really just taking the time out for you. And, one of the questions I often get is, do people talk throughout the treatments or do they stay silent? And it's really dependent. I think your body, when the needles go in, your body gives you the answer to that. There's patients I've had who fall asleep for, 2 hours and I'm kind of too scared to wake them up. There's other patients who want to talk the whole way through. And I think it really depends on your unique situation on that day of the treatment. But I think, a lot of it goes into supporting you as a person. So supporting you kind of emotionally and just being there to be a friend that listens to you. Because I think sometimes, I've got patients who don't want to talk about their health because they don't want to worry their family or things like that. And we're that independent person who you can just be yourself and rant about whatever you want or whatever else. So a lot of the treatment is to do with the needles that we choose and the diagnosis that we make and how we restore the balance of energy. But a lot of it as well is that kind of emotional and kind of physical support in many respects. And my fourth lesson is, at present, it says a 27-minute recording. So it's not long to go through all of acupuncture. And I've kind of given myself a hard challenge of talking about the emotions, which is such a deep area. And we really just scratch the surface. There's so much more behind acupuncture and different ways of treating. And, I could go on for days, weeks, months, but I've tried to cover a little bit of some things I think about just so it gives you a sense of acupuncture really can help with anything. You don't have to be gravely ill. It doesn't have to be a muscle problem or a musculoskeletal issue. It could just be, hey, I'm struggling to make a decision and it's affecting my sleep. Can I come and see you? And we can do kind of a supportive treatment, um, covering over 3 years of kind of studying can't be done in 30 minutes, I'm afraid. So it's a very complicated topic. People are complicated as well. People present in different ways. Um, I've done my best, I hope, and I hope you found that it's an interesting talk and learnt a little bit about how acupuncture can help, how acupuncture works, and the sort of things that we go through in a treatment, which, there's a lot that goes on behind the surface. It often looks, how do you choose the points? And this kind of gives you a little bit of a perspective of what we're going through. So thank you. Thank you for listening. I hope it's helpful. I thought it's such a great topic. It'd be a shame just to only have it for the people that attended the Medicide Open Day. So this is just the quick recording. If you have any questions or would like to discuss it anything further, or if you'd like to book in for a treatment, or just have a chat, my details are here. I'll be sending some through an email, so you also have my details there. So feel free to get in contact and thank you for watching.